Next, we come to the most important part of the consultation, and that's the discussion of the hairline. Now, what I like to do is I like to draw the hairline in front of you as a patient to show you what I anticipate doing during the procedure. Many factors come into play when we're designing a natural hairline. For example, ethnic variation. Oftentimes we'll see more rounded hairlines in Latinos and African Americans, whereas in most Caucasian people, you'll see a little bit of temporal recession, as I have here. We also have a difference in jagged versus smooth hairlines. In a lot of people, they'll have some peaking in their hairline. For example, the classic one is going to be a widow's peak in the center, but oftentimes people will have some jags on the side. We have sentinel hair nodes, which are individual fine hairs that are scattered in front of the hairline that we see. So we like to add those in order to make it look more natural. The direction of the hair changes in different parts of the scalp. For example, above the ears, you'll see the hair grows typically straight down, whereas in the back of the head, you'll see more of a swirl pattern where the hair kind of fans out in a swirl type distribution. A natural appearance is more important than density to me. What we like to do is we like to use single hairs in the front of the hairline, and then we'll use double hairs or triple hairs as we go further back. The hair transplant surgery is permanent because the hairs that we're harvesting from the back of the head are resistant to hormonal changes. So when the work is done well, this is great. However, in the past, when people had the hair plugs done, they were permanent, and this led to an unpleasing result that discouraged many people from having hair restoration surgery. This is especially critical in hairline design because we want to make sure that it's natural since it is forever. And we want to make sure that it works as you mature. Because what will happen is oftentimes your hairline will recede back or you will get more thinning on the top of the head. If the design of the hairline is not done correctly, you can end up with islands of hair with areas of hair loss behind it. The donor areas is critical because the donor hair is finite. You don't have unlimited hair. So we want to make sure we maximize where we place those grafts. We demonstrate with a mirror or with pictures where the donor site is going to be and where the scar is going to be located. And then we also discuss the fact that we're going to just trim the hairs where we're harvesting hair follicles. So after the procedure is done, you shouldn't have a shaved area that's visible. Prior to surgery, we'll talk about the restrictions that you have, and this would include stopping all blood thinners for 10 days prior to the procedure, restricting your smoking, as well as alcohol intake. Next, we talk about the timing of the hair growth. Typically, after the transplantation has taken place, the transplanted follicles are going to fall off in 1 to 2 months. Next, what we'll see is some of the hairs are going to start to regrow at about 3 to 4 months, and then you'll have your final result at 6 months to a year. We like to have people bring a driver with them or call a driver at the end of the surgery because during this procedure you may get pain medications or medications to help you relax, which could impair your driving. Sutures remain in the scalp until 7 to 14 days when we set you up with an appointment to have them taken out. And in terms of shampooing, what we like to do is have you not shampoo for 1 to 2 days, and then we'll have you gently shampoo your hair, and after 10 days you can resume normal shampooing. For those of you who are interested in hair restoration surgery, I highly encourage you to come in for a consultation to one of our locations. We have offices in Newport Beach, Rancho Mirage, and Palm Springs. We also are happy to do online consultations as well as telephone consultations. Please visit us at www.contourderm.com.